Hey everyone! Thanks for tuning in to listen to this special edition episode of Healthy Dose of Dialogue podcast, where we'll talk about health equity, its challenges, and how the healthcare industry is driving progress. Since the pandemic struck, many of the nation's health disparities have been laid bare. Low-income workers, especially those in the service industry, were put at highest risk, while COVID-19 hospitalizations and deaths disproportionately impacted minority populations. For example, a published study by the American Heart Association found that during the pandemic, African American, Hispanic, and Asian populations suffered a 20% increase in heart disease deaths, compared to just 2% for Caucasian Americans. And since December 2020, the Centers for Disease Control reports African Americans in the U.S. have had the lowest vaccination rates. Sara Teppema, president and founder of Alta Health Advisors, said the pandemic revealed long-standing gaps in healthcare access and outcomes. She said the data shows neighborhoods of color and impoverished communities are at an increased risk for health issues, like mental illness, chronic disease, higher mortality rates, and lower life expectancy. For progress, she said it requires healthcare reform and an investment in social programs.
Depending on who you are in this country, you can have the best healthcare in the world or the worst. We do know that compared to other OECD nations, we have the highest healthcare costs per capita GDP, and we have the lowest investment in social infrastructure.
In the private sector, the investment firm Health Equity Ventures is harnessing the power of venture capital and directing it at startups that improve health outcomes for vulnerable communities. The group hopes to raise $50 million and is investigating a deal with Sera Prognostics, a startup working to prevent childbirth-related deaths. Dr. Michael Penn, Health Equity Ventures founder and managing partner, said their goal is to pioneer an investment strategy that improves lives.
Innovation happens when people hear, oh, this will never work, and they say, well, I'm going to try anyway, right? Because this is either important to me or because this must be done. And I think what is absolutely clear to me is that we have to do things differently in healthcare, right? We have to do things differently in our society.
John Baackes, CEO of LA Care Health Plan, works to provide equitable health options for Los Angeles County's most vulnerable and low-income residents. Under his leadership, LA Care Health Plan improved services by establishing a scorecard to measure provider performance and used grant funding to generate a pipeline of high-quality physicians for Medicaid recipients. He said the pandemic has served as a wake-up call for people to see the disparities in our health system and take action.
44% of our members in Medicaid here in Los Angeles County are Latino. They were getting infected, hospitalized, and dying at 3 times the rate of everyone else. So if this doesn't put a spotlight on the fact that these social determinants are real barriers to somebody's improved health, I don't know what will.
Visit doseofdialogue.com, where you can listen to the latest episodes and hear from industry experts mentioned in this special edition of the podcast. You can also join the conversation on LinkedIn and Twitter at Dose of Dialogue. Thanks for listening.